Hello, listeners. Welcome back to our podcast, Everyday Health Stories, where we explore the fascinating world of medical science through the power of storytelling. I'm Anna, and as always, I'm joined by none other than the storytelling MD, Dr. Kota Reddy.
Thanks, Anna. I'm really excited about today's episode because, we're diving into something that affects so many people but isn't talked about enough. This is, of course, all about fainting or syncope, for a more technical term.
Oh my gosh, yes. I actually have a friend who fainted at a wedding last month, and it was pretty scary. Everyone was like panicking and didn't know what to do.
It can be really frightening, right? And that's exactly why we need to talk about this. Today, we're going to break down the science behind fainting, particularly something called vasovagal syncope, which is actually the most common cause.
Before we dive in, just a quick reminder to our amazing listeners to hit pause and subscribe to the podcast. You'll get notified of new episodes, gain access to exclusive content, and join a community that's making positive changes, one story and one micro habit at a time. That being said, so Dr. Reddy, when someone faints or even just feels like they're about to faint, what exactly is happening in their body? Could you walk us through the process that leads to this reaction?
Well, you know what's really interesting about fainting? When someone passes out, there's actually quite a few different things that could be going on, like it could be something with the brain, the heart, or even blood clots. But here's the fascinating part.
So there are multiple causes? That's actually pretty surprising. I always thought it was just like people getting dizzy or something.
Right. But here's the thing that really blows my mind. If we look at 100 people who faint, about 98 of them, and I'm not exaggerating here, are fainting for the exact same reason. It's called vasovagal syncope.
Vaso what? That's quite a mouthful.
Yeah, it's a bit of a tongue twister. But basically, what happens is both your heart rate and blood pressure drop at the same time. And it's all connected to this really important nerve in our body called the vagus nerve.
Oh, wow. I've heard of blood pressure dropping, but I didn't know about the heart rate part. That sounds pretty serious.
Well, here's what's really interesting. It's actually a protective mechanism our body has. You see, we've got this part in our brain called the vagus nucleus, and it's connected to this huge nerve that runs through our whole body. And when it gets activated, it's like, well, think of it as hitting the brakes on your car.
So our body is actually trying to help us when this happens?
Exactly. It's kind of like having a built-in safety system. The thing is, though, in some people, this system becomes a bit too enthusiastic, if you will. It's like having super sensitive brakes that slam on when you just meant to slow down a little.
That's actually a really good way of explaining it. But what makes this system go into overdrive in the first place?
Right. So let me tell you more about this fascinating vagus nerve. It's actually the longest nerve in our body, and it's really, really incredible what it does. You know how I mentioned it's like having brakes? Well, it's actually way more complex than that.
What exactly does it do, like on a daily basis?
Oh, it does so much. So think of it as, well, it's like the body's main communication highway. It starts right up in your brain, and then it just keeps going, running all the way down through your neck, chest, and into your abdomen. It's constantly sending messages back and forth.
That sounds really important, but how does it actually, cause someone to faint?
That's exactly the right question. So here's what's fascinating. The vagus nerve is part of what we call our parasympathetic nervous system. It's basically like, well, think of it as your body's relaxation response. When it's activated, it slows down your heart rate, lowers your blood pressure, and even affects things like digestion.
Oh, wow. So when someone faints, is it like the system going into overdrive?
Exactly. You see, normally this system helps keep everything in balance. It prevents our blood pressure from getting too high, helps manage inflammation. It's actually really protective. But sometimes it can become a bit too enthusiastic in its response.
So what happens then?
Well, when it overreacts, it's like hitting that brake pedal way too hard. Your heart rate drops suddenly, your blood pressure plummets, and boom. Not enough blood flow gets to your brain, and that's when you pass out. The thing is, though, this is actually your body trying to protect itself. It's just, well, it's being a bit overzealous about it.
That's actually really fascinating. I had no idea our bodies had such a complex system. So, what are some of the things that can actually trigger this response? Like, what should people watch out for?
Oh, there are quite a few triggers. And you know what's interesting? They're actually pretty common things that we encounter in our daily lives. Let me break this down for you.
Yeah, that would be really helpful.
So, first of all, dehydration is a big one. And this is especially true if you're someone who loves their coffee or energy drinks. The caffeine can actually make dehydration worse.
Oh, wow. I drink so much coffee. Should I be worried?
Well, moderation is key, but there's more. You see, some triggers are really physical, like intense pain, or even something as simple as standing for too long. You know those long church services where everyone's standing? That can definitely do it.
Really? That's kind of scary.
It can be, but knowledge is power. Other common triggers include things like, well, believe it or not, excessive coughing or even intense laughter. And here's one that surprises a lot of people. Straining during bowel movements can trigger it too.
No way. Even laughing?
Absolutely. And let's not forget about nausea. That's a really big one. Your vagus nerve is super sensitive to that feeling of being queasy. Oh, and something people often don't think about, getting up too quickly. You know when you're lying down and suddenly jump up? That can definitely trigger an episode.
These all sound like really normal things that happen to everyone, though.
Exactly. And that's what makes this so interesting. These are totally normal activities. But for some people, their vagus nerve just responds more strongly to these triggers. It's like, well, imagine some people have a more sensitive alarm system in their body. The same trigger might cause a minor response in one person, but a full fainting episode in another.
So, do you have any real life examples that could help us understand this better? Like, actual cases you've dealt with?
Oh, absolutely. Actually, I have this really fascinating case that I think perfectly illustrates what we're talking about. Let me tell you about one of my patients.
Oh, yes, please do.
So, this was a really active guy, right? Just 40 years old, absolutely in the prime of his life. And you know what made him special? He was this amazing community worker, like constantly on his feet, organizing events, running local outreach programs, and managing his family life all at the same time.
Wow, he sounds super busy.
He really was. And you know what was incredible about him? His energy was just contagious. Like, he was one of those people who never really worried about his health because, well, he was always so active and healthy.
So what happened to him?
Well, that's where things got really interesting. And honestly, quite scary for him. He started fainting, and not just once or twice. We were talking every few days, completely randomly. One minute he'd be standing there, laughing with his friends or setting up for an event, and the next thing, boom, he'd find himself on the ground.
Oh my gosh, that must have been terrifying.
Absolutely terrifying. And you know what made it worse? Every time he'd come to, he'd see his friends and family gathered around him with these looks of absolute panic on their faces. The unpredictability was really taking a toll on him. I mean, imagine not knowing when you might just pass out next.
That's just, wow, it must have really affected his daily life.
Oh, completely. You could see how it was draining him, not just physically, but emotionally too. He was becoming really anxious about the whole situation, and that's when he decided to come see us for help.
So, what did you do first when he came to see you? Like, how do you even start figuring something like this out?
Well, you know what's interesting? We actually have a pretty comprehensive approach when someone comes in with fainting episodes. First thing we did was run all the routine tests, EKGs to check his heart rhythm, extensive blood work, various imaging studies, basically everything you'd think to do in a case like this.
And did those tests show anything?
That's the thing. They all came back completely normal. And you know how in medicine, sometimes the most frustrating thing is when everything looks fine on paper, but you've got a patient who's clearly suffering?
Oh, wow, that must have been so discouraging for him.
Yes, but here's where it gets interesting. We have this absolutely brilliant specialist. He's a cardiologist and electrophysiologist who's really made a name for himself in understanding the autonomic nervous system and fainting disorders.
Oh, what makes him so special in dealing with these cases?
He's got this incredible expertise in understanding fainting that's connected to heart rhythm and blood pressure issues. And he's particularly known for his work with something called tilt table testing. It's actually quite amazing what this test can reveal.
A tilt table test? That sounds interesting. What exactly is that?
A tilt table test checks how your body responds to changes in position. In this test, the patient is strapped to the table and the table is inclined at 70 degrees angle. It's like the patient is standing at this point, right? Then the blood pressure and heart rate are monitored throughout the test. Most people who have vasovagal syncope within 10 to 15 minutes, because of the pooling of the blood in the legs, their heart rate goes up, blood pressure drops, and then the vagus nerve gets activated and their heart rate drops along with the blood pressure dropping, and then they pass out. Immediately, the table is tilted back to normal, to 0 degrees, where they become flat, and then they recover. And that's how we diagnose if the patient has vasovagal syncope or not.
Oh, and what happened with your patient during this test?
Well, that's where things got really interesting. At first, everything seemed totally fine, but then, as we increased the angle of the table, something fascinating happened.
What did you see?
So we're watching the monitors, right? And suddenly, this was exactly what we were looking for. His heart rate and blood pressure they took this dramatic drop. And before we knew it, boom, he actually fainted right there on the table.
Oh my gosh, was he okay?
Yes, absolutely. You see, this is exactly what we wanted to happen. Well, not wanted exactly, but you know what I mean. It confirmed what we suspected all along. This was definitely vasovagal syncope.
So the test actually caught him fainting in real time? That's incredible.
Exactly. And let me tell you, this was such a valuable moment because it showed us exactly what was happening in his body. The tilt table test it's like catching the culprit red-handed, if you will. We could see his vital signs changing right before our eyes.
And this helped you figure out what was causing it?
Well, it definitely confirmed the mechanism of his fainting. But here's the thing. We still needed to understand why his body was suddenly reacting this way. And that's where the next part of our investigation led us to something really unexpected. After he came to, we sat down to explain what we'd found, and something he said just changed everything.
Oh, what did he tell you?
So he's sitting there, processing everything we're telling him about vasovagal syncope, right? And suddenly he goes, I just got back from this missionary trip to Africa. It was amazing, and here's the key part. I picked up some kind of stomach bug while I was there.
Ooh, and that was connected to the fainting?
Exactly. See, he'd been dealing with these waves of nausea ever since he got back, but he never really thought much of it. But when we started talking, he realized something fascinating. Every single time he fainted, he'd been feeling nauseated.
Wait, so the nausea from the stomach bug was actually triggering the fainting?
That's absolutely right. And this is what makes medicine so incredible. Sometimes it's like putting together pieces of a puzzle. The nausea was basically, it was like pulling the trigger on his vagus nerve, causing this massive overreaction that made him pass out.
That's amazing. And I guess he hadn't made that connection before?
Not at all. You know how it is. When you're in the middle of something, it's sometimes hard to see the pattern. But once we had that piece of information, wow, everything just clicked into place. The nausea was it was like the missing link we needed to really understand what was happening to him.
And this was all because of a trip to Africa. That's incredible.
Right? It just shows you how connected everything in our body really is. One thing leads to another, and before you know it, you've got yourself quite the medical mystery to solve.
So, once you figured out what was causing his fainting spells, what happened next? How did you help him get better?
Once we understood that nausea was the primary trigger, we could actually develop a really targeted approach to help him. First thing we did was we started him on some medication to help control the nausea from that stomach bug he picked up in Africa.
Oh, that makes so much sense.
And then, you know what was really crucial? We worked with him to develop these, let's call them early warning strategies. We taught him how to recognize when he might be at risk of fainting and what to do in those moments.
Like what kind of strategies?
So, whenever he'd start feeling even slightly nauseated, we had him immediately sit down, or even better, lie down. And this is really important. We had him keep really well hydrated, always carrying water with him, that sort of thing.
That seems like such a simple solution.
Exactly. Sometimes the simplest solutions are the most effective. And here's the beautiful part. As his body started recovering from that stomach bug, and as he got better at managing his triggers, those fainting episodes, they just started becoming less and less frequent.
Wow, so he was able to get back to his community work?
Oh, absolutely. Within a few months, he was back to his usual energetic self, organizing events, running programs, but now he was just so much more aware of his body's signals. And that awareness, that was really the key to preventing any future episodes.
I'm really curious about something. When you're trying to figure out why someone's fainting, Are there like other tests besides the tilt table that you typically do?
Oh, yes, absolutely. You see, there's this whole array of diagnostic tools we can use, and they're all really fascinating. One of the key tests we often start with is what we call a stress test.
A stress test? What exactly is that?
So think of it like this. We basically get to watch your heart in action. The patient walks or runs on a treadmill while we monitor their heart's response. It's actually really amazing because we can see exactly how the heart functions under different levels of physical stress.
That's so interesting. And what are you looking for exactly?
Well, we're watching for any abnormal heart rhythms or rates that might pop up during exercise. Sometimes, the heart might be perfectly fine at rest, but when we challenge it a bit, that's when we can spot any issues that could be causing someone to faint.
Oh, wow. And what if nothing shows up on those tests?
That's where it gets really interesting. If both the stress test and tilt table test come back normal, we might consider something called a loop recorder. It's this tiny device, and I mean tiny, that we actually implant under the skin.
Wait, you actually put something inside the person?
Yes, but it's really not as scary as it sounds. It's about the size of a small USB stick, and it's absolutely amazing what it can do. It continuously monitors the heart rhythm day and night for up to 3 years.
3 years? That's incredible.
It really is. And here's the really cool part. If someone faints, they can actually mark the event using a special device, and we can go back and see exactly what their heart was doing at that moment. It's like having a 24/7 heart detective on the case.
That kind of technology is just mind-blowing. But what happens if all these heart tests come back normal?
Well, that's when we start looking at neurological causes. If someone faints while standing and doesn't have a seizure, it's usually more likely to be heart-related or vasovagal syncope rather than a neurological issue.
So, Dr. Reddy, with everything we've learned today about fainting, what can people actually do, to prevent these episodes from happening?
Well, Anna, I'm really glad you asked because there are several practical steps that people can take to reduce their risk of fainting. And the first one is super important, staying hydrated.
Oh, like drinking enough water throughout the day?
Exactly. And it's especially important if you're someone who drinks a lot of caffeine because, caffeine can actually make you more dehydrated. But there's more to it than just hydration.
Really? What else should people be aware of?
Well, one of the biggest things is learning to recognize your triggers. Like our patient who would faint when he felt nauseated. Once he understood that connection, he could take steps to manage it better.
That makes so much sense. And are there other common triggers people should watch out for?
Oh, yes, absolutely. Things like pain, standing for long periods, like at church services or long meetings, and even straining during certain activities can trigger these episodes. But here's something really important that people often overlook.
What's that?
The way you stand up. I always tell my patients to take it slow when getting up. You see, if you jump up too quickly, your blood pressure might drop suddenly and that's when you might feel dizzy or even faint.
Oh, wow. I had no idea something so simple could make such a difference.
It really can. And here's another practical tip. Avoiding overexertion. Situations that really get your nervous system going, like intense laughter or excessive coughing, they can sometimes trigger that vasovagal response we talked about earlier.
These all sound like such manageable changes people can make. But when should someone actually see a doctor about their fainting?
That's really important, Anna. If someone's experiencing frequent fainting spells, they should definitely get checked out. It's always better to rule out any serious cardiac or neurological issues early on. And sometimes just having that peace of mind can make a huge difference in someone's quality of life.
Dr. Reddy, this has been such an eye-opening conversation about fainting. I feel like we've really gotten to the heart of this topic today.
We really have. And I just want to emphasize something really important to our listeners. While fainting can be scary, it's usually manageable with the right knowledge and care. But, and this is crucial, you should never try to self-diagnose.
Oh, absolutely. And this would be a good time to remind everyone that this podcast is for informational purposes only, right?
Yes, exactly. Please remember, this podcast is for informational purposes only and is not a substitute for professional medical advice. Always consult your healthcare provider for any medical concerns.
And before we wrap up, I just wanted to say, if you're enjoying everyday health stories, please subscribe to the podcast so you'll get notified of new episodes, gain access to exclusive content, and join a community that's making positive changes in their lives. One story and one microhabit at a time.
That's right. And you know what? I really hope today's episode helps someone out there understand their fainting episodes better, or maybe even recognize the signs in a loved one.
Oh, definitely. And where can our listeners find more information about this topic?
Well, they can always visit our website and we'll include some helpful resources in the show notes. But remember, your first step should always be talking to your healthcare provider if you're experiencing fainting episodes.
Thanks so much, Dr. Reddy. This has been another fascinating episode of Everyday Health Stories.
Thank you, Anna, and thank you everyone for listening. Until next time, be kind to yourself, prioritize your well-being, and strive to be the best version of yourself. Remember, every story has the power to transform lives.